Heart attacks kill 6 times as many women each year as breast cancer, and it's the leading cause of death in women over 65. Dr. Salima Qamruddin is here to share 5 heart-healthy tips. Good morning. Thanks so much for joining us.
Thank you for having me here.
Well, that's quite a sobering statistic in this Women's Heart Month. You know, it's amazing. You want to say, what can I do to prevent this from happening to me? What can we do?
Well, I'll start off by saying that there are significant gender differences in cardiovascular disease between men and women. Women tend to have more, at the time of the heart attack, women are more likely to experience nausea, arm pain and stomach ache rather than chest pain. So it's important to understand that the cardiovascular disease presents differently between men and women. What are the risk factors? Presence of diabetes, high blood pressure, having family history of premature heart disease, having a sibling or a parent that has had heart disease, heart attack in the 5th or the 6th decade of life, having high cholesterol, sedentary lifestyle, which means, you know, we all have desk jobs and we cannot exercise as much. So wearing a Fitbit, looking at the number of steps that we're taking, those are the modifiable risk factors that we can prevent and treat to prevent future cardiovascular disease.
So keeping moving is so important, and really women, we're not saying men don't do a lot too, but women are always the caretakers of everyone and trying to do everything at all times.
Agreed.
And you ignore the side effects. So if your arm's tingling, or what kind of things happen to us when it could be something with our heart and we just don't even know?
That is a fantastic question. So if you have risk factors, if you have significant presence of diabetes, high blood pressure, and they're untreated, you have family history, it's important to understand that heart disease or heart attack can present differently, and you may experience just nausea, which is persistent and it's not getting better, or you're having pain in the arm that seems odd and you're feeling fatigued. Those are things that should prompt immediate attention for you to call your doctor, for you to go to the emergency department.
Okay, so when it comes to checkups, let's say we've been living a horrible lifestyle but want to start today, how many times do we need to get our heart checked, or what kind of diagnosis can you do through
That's
testing?
a great question. So we start by screening. So women that have family history of diabetes and high blood pressure, they need to follow up regularly with their primary care doctor. The screening tests are primary fasting blood sugar to make sure that you're not a diabetic, screening for high blood pressure, then there is screening for cholesterol, and depending on the number of risk factors that you have, you may have significantly increased risk for cardiovascular disease. Now, I also want to point out that there is a type of chest pain which is not from a major blocked artery. It can be from chest pain from small arteries of the heart. A lot of women experience chest pain and have a stress test that's negative, but it turns out that they may have another condition called microvascular dysfunction that requires more sophisticated testing. It is not diagnosed by regular stress testing. So we want to encourage women who have chest pain, who have seen different doctors, who have had stress tests, to get re-evaluated for chest pain that may not be from a major blocked artery.
So ask your doctor, always consult your doctor. Thank you. Dr. Salima Qamruddin, you enlightened us on a lot of things. We appreciate you.
Thank you for having me.
Time now for a check of the